Good morning, everyone, and welcome to Workplace Health Insights Live. For those of you joining us for the first time, we've designed this series to discuss the healthcare challenges facing UK business. In part of our commitment to keep you updated on the latest health and wellbeing trends, so you'll always feel one step ahead. Now, for those of you that I don't know, I'm Richard Norris. I've had the pleasure of being in the health insurance industry for 21 years and 11 of those at Bupa. And until recently, I led our SME and specialist business. Following the announcement that Mark Allen has taken on a new role at Bupa, leading our dental care business, I have the privilege of taking on the new role of General Manager for the business and specialist products. So I'm delighted to be hosting today's session where we'll explore the value of a neurodiverse workforce. So the pandemic highlighted the need for organisations to have more inclusive and flexible cultures where everyone has the potential to thrive at work. This is something we are absolutely passionate about at Bupa. And with a challenging talent market and continual pressure to gain a competitive edge, it's more important than ever that organisations address how they integrate a more diverse workforce. Now, in previous sessions, we talked about the value of putting DE&I, diversity, equity and inclusion, at the centre of your health and wellbeing strategy. A key part of this is addressing how employers can support neurodiversity in the workplace. Simply put, neurodiversity refers to the way that everyone's brains naturally work differently from one another. So just as you may have been born right-handed or have green eyes, how your brain works and where you sit on the cognitive spectrum will be unique to you. Now, most people are neurotypical or non-neurodivergent. This means they think and behave in a way that is similar to most other people. But around 1 in 7 people are neurodivergent. This means they behave, think, process, and interpret information in ways that differ from most other people. Traditional working practices are often designed with neurotypical society in mind, which can make it difficult for neurodivergent employees to thrive at work. Now, when companies embrace neurodiversity, they gain competitive advantages in many areas, including attracting new talent, skills, and perspectives. And research suggests that teams with neurodivergent professionals in some roles can be 30% more productive than those without them. So it's a huge opportunity for business. It's encouraging to see that more organisations are starting to embrace neurodiversity in the workplace, but there is much more we can collectively do. How employers choose to provide an inclusive environment for their neurodivergent workforce can benefit the entire workforce. Considerations for neurodivergent employees may evolve traditional working practices to make the workplace a better, safer, and more inclusive place for everyone. So, with that in mind, we have a packed agenda today. First up, we'll hear more about the clinical landscape for neurodiversity in the workplace from Professor Amanda Kirby. I'll then host a conversation to discuss the priorities for employers between Amanda and Louise Harvey, our Director of PMI Propositions at Bupa. Next up, I'll invite Marc McNeill, Customer Experience Director at Auto Trader, and Richmal Maybank, Employer Engagement Manager at the National Autistic Society, to discuss the practical steps employers can take to support neurodivergent individuals in the workplace. And then finally, we'll have some time to answer your questions. So please send these through in the chat during the session and we'll answer as many as we can. So I'm sure you'll agree we've got a fantastic lineup for you today. Let's get started. So I'd like to welcome our first guest, Professor Amanda Kirby. Now, Amanda is the founder and CEO of Do It Solutions, who provide training and consultancy in the area of neurodiversity and wellbeing. Amanda has led a clinical research team for 20 years, is a qualified GP, and has a PhD, all relating to neurodiversity. Amanda has been on government advisory boards, as well as advising UK and international charities in the field of neurodiversity, including her current role as chair of the ADHD Foundation. She's written 9 books and more than 100 research papers in the field. Amanda also has lived experience of neurodiversity firsthand, as she sees herself as neurodivergent, as well as being a parent of neurodivergent children and grandchildren. Amanda is passionate about making a change in society and increasing the chances for neurodivergent people, especially in work settings. So we're delighted to have you here today, Amanda. Huge opportunity for us all to hear from you, and I'll hand over to you for the next 15 minutes.
Thank you very much, and thank you for that kind introduction. Well, good morning to everybody, and I'm really pleased to be here today. I'm going to talk to you a little bit about neurodiversity and what it is, and going to run through a lot in a short space of time. So I hope you've got your cup of coffee and you're ready to go. So I'm going to introduce neurodiversity. What are the words we're using and why? We started to hear that just a moment ago. What are organisations and individuals experiencing? So what's going to be important? Why should your organisation become neuro-inclusive? And we've already heard that the talent, attracting and retaining talent is going to be important. So I'm an oddball. I am a medic, but I work in education, work in the workplace. I am neurodivergent and I come from a neurodivergent family, but experience some of that in terms of recognising who I am later in life. And some of the people you work with are going to be certainly like that. And I've been working in this field for a long time. So let's get started. Let's start with the words we use and how we use them. Neurodiversity, what is it? It's our brain's neuro, naturally vary from person to person, and are diverse and are part of human variation. We all think, move, act, process information and communicate differently. Now, Judy Singer from Australia is a sociologist, Harvey Bloom from America wrote about this in the late 1990s, really thinking about the concept of biodiversity. Why do we get super specializations in animals and reptiles and in plants? Why wouldn't we have those spiky profiles in individuals? But our society is really set up for the average person. So I'm just trying to move, next please, just move the slide on. So in your workplaces, you're going to have exec teams in the C-suite, you're going to have customers, clients, colleagues, you're going to have people in the supply chain. You want to recruit talent, and in this global talent shortage, you'll need to get people into the workplace, but you've also got people there already. And like me, you may also have children, or you, like me, might be neurodivergent or recognizing that you are. So we're talking 15 to 20%. If we think about that bell curve, what we've set up in society is that we conform to an average. So the average way we recruit people is we tend to do an interview, which is great for people where you want to check communication skills, but in a job where somebody doesn't need communication skills, if you're recruiting a bricklayer, perhaps you want to see they can do the job rather than actually they can do a really good interview. So society is set up very much for the average. And if you're neurodivergent, you are either side of these averages in the way you think, move, act, and process and communicate, then unless we support individuals, then that's going to be harder to get in and showcase your talents. So some key words that you might hear. You might hear neurodivergent. This is diverging from that neurotypical space. And it's a social construct. It's the way we set up education as well, that kids have to sit in rows and have to do an exam. But if you don't fit like that and you can't sit still for long, that's going to be a challenge for you. Neurotypical, that's the people who fit in that middle of that bell curve. And neurominority are specific groups that we associate with specific conditions like ADHD and autism. So neurodivergent, divergent can seem like a rather negative framing. Actually, we can have positive framing in terms of this spiky profile of the things that you can do. So you might be really good at hearing things, really good at recognizing faces, a really good down that end Premier footballer. There aren't that many of them. Or you can diverge negatively and you might have difficulties with kicking a football or smelling things or hearing. And that's going to be challenging if you can't showcase your talents. The reality is most of us have a spiky profile. So we've got some strengths and we've got some challenges. But if there is a spikiness where your talents are spiky, but your challenges are not being supported, this is why you can't perhaps fit into a standard system, that average. I've never met an average person. And when we look at the way we design today, we need to be moving away from that industrial area where we need generalists to a specialist area in this digital era. So next, please. So what we see is that neurodiversity, you can be born with traits and conditions like developmental language disorder. Children who have speech and language delay might get diagnosed with developmental language disorder. Later on, when you get to school, you might get a diagnosis of dyslexia because you're having challenges with reading and spelling. Autism might be diagnosed in some people a little bit later because of communication challenges they might have in school. ADHD, sometimes we're seeing children getting diagnosed even later when they're finding it hard to focus and concentrate. Developmental coordination disorder later. Now, all of these things co-occur. We've got 84 billion brain cells connected in billions of different ways so that each person might have a different combination. Also, we can acquire conditions later in life. So you can have acquired reasons for difficulty communicating, moving, acting, and processing information. So perhaps you might develop Parkinson's. So people can have dyslexia and Parkinson's. Really important to think about that. Next slide, please. So we need to think about taking a person-centered view. And when we're thinking about neurodiversity, often we're thinking about specific conditions like autism and ADHD, and it can be important for people to gain a diagnosis of those. Also things like dyspraxia, coordination difficulties. But what we need to realize that each person, overlap is the rule, co-occurrence is the rule. This is really important, so that each person will have their own spiky profile of strengths and challenges. Next slide, please. So when we're thinking about neurodiversity, we've also got to remind ourselves we've only got one brain. And often sometimes we think about mental health over here and neurodiversity over there. But the reality is we have one brain, and it's often the same neurotransmitters. And also we see that with neurodiversity, people have an increased risk of things like anxiety and depression as well. Next slide, please. So very few people are just one thing. That's really important for the workplace, that we are person-centered, not label-led. Some people will want a diagnosis, but each person is going to be different. No two people, even with the same diagnosis, are going to be the same. So you could have somebody on the autism spectrum who's verbal, somebody on the autism spectrum who's non-verbal, somebody who's a graduate, somebody who's got intellectual disability. And it goes across, it's a neurodivergent spectra, really, of spectras. Next slide, please. So we're going to flip the narrative. We're moving away from that negative construct of difficulties, disabilities, disorders, and deficits to start to recognize that people come with strengths. Next slide, please. And we're really seeing that, and that's the talent that you want in your workplace. So what we've had till now is that you've had, this is your balls in the bucket, this is your brain. It's obviously not your brain, but we've worked on a bad enough principle. You have to reach a diagnostic threshold to get a diagnosis. But the reality is, if you're sub-threshold, you don't quite reach that threshold, you still might need some support in the workplace. Next slide, please. And the reality also is that some conditions are better known than others. So even though autism, about 1 to 2% of people in the population have autism, 7.5% of people have developmental language disorder. Much more common, but far less understood and known in that sense. So the balls you've got in your bucket might determine whether you get support or you don't. Next slide, please. So what we've got to think about is in the workplace is that the person gets support, whether they have a diagnosis or not. And some people want that, need it, but others may not. Next slide, please. You're the same person even the day after you've got a diagnosis to the day before, but sometimes we reflect back on the past of, if I'd only known that, then I could have done X. And so some people might be working through that. So two people with the same diagnosis are very different people. Next slide, please. So not everyone comes to work with a diagnosis. This is really important. Often we think that people are going to tell you, but they may not be able to tell you because they don't know they've got a diagnosis. And we often see females, particularly 30s, 40s, 50s and 60s, who certainly haven't been given a diagnosis because we were looking through a sort of male lens till relatively recently. And those who are moving around a system often miss out at the margins of society. Next slide, please. So we've got those spiky profiles, okay? Each person's going to be different, even like your fingerprints. We are hugely variable in terms of our strengths and challenges. Next slide, please. So what are the 5 reasons neuro-inclusive practice is good for business? Let's look at those one by one. So next, please. Attracting and not wasting talent. So we want to avoid cookie cutting hiring. We really want differences in and different solutions. Next, please. We can just click through these. Retaining the talents that you have and reducing absenteeism. We need to keep the people in the workplace we've got a talent shortage. Team productivity and novel thinking. We need to avoid that group think. We really need new solutions. and it's reputationally good for society as well. This is Gen Zs really want to know that you care. We've got this sort of quiet quitting going on at the moment being discussed as well. Next slide, please. And then reducing the risk of litigation. Okay, let's move on. So what are your current processes? If we're thinking about recruiting and retaining talent, next slide, please. Well, I asked this on LinkedIn. I put a weekly newsletter and poll quite often. In March of this year, I asked employers, what stops you recruiting someone who's neurodivergent? And what was key was lack of knowledge. So that's why these sort of spaces and places to discuss this are so important. But I thought what's interesting is that time was the next one down, and then cost. People don't always say cost because it's a perception that it's going to take a lot of time. But in actual fact, a lot of the adjustments you need really don't cost a lot and can make a huge difference to somebody's productivity. Next slide, please. So most approaches don't cost a lot. It's often thinking about time, place, space, and clarity of information. Most people start to say it's about communication. It's that dialogue that you have between each other that makes so much difference. Next slide, please. So every person's profile is going to be different. So it's no good saying dyslexic people get beige paper and people with ADHD need headphones. That might be the case for some people, but the job you're doing, the environment you're in will make a difference to the adjustments that you require. And each person is going to be different as well. Next slide, please. So what we need to be thinking about, I love Galway's definition of performance equals potential minus interference. So if we're really thinking about how do we support people, we need to be thinking about what are the things that are interfering with that person being their best, most productive self. Next slide, please. And this really is, are you neurodivergent? Was another thing I asked recently. If there was one workplace adjustment, what would it be? And that was about the thing that came out top was attitudes. And attitudes are free, but they're important to change your attitudes and raise awareness to know that there are people who are neurodivergent in every workplace and space and coming into your workplaces too. Next slide, please. And really, when we're fine graining, if you're thinking about what you need to do and put things in place, we do really need to think of all the different components. Advertising for interview, induction, thinking about where you are now. And it might be that you're advertising, but you're not telling people that they can get adjustments and you're not clear about what's available to them all the way through that process and even when onboarding. Next slide, please. And so you can do a year plan. This is just an example of a year plan. If you're starting off, awareness at senior leadership, doing your gap analysis to see where you are, setting your priorities, awareness like this today is so important, leadership training, getting your ERGs and your affinity groups set up if they're not, getting your interviews and adjustments, screening and support, accredited training if you want to, and universal design review, trying to open the door to as much talent as possible. And last slide, I think it is. Thank you very much. And if you want more information of what we do, then here's some more information. But thank you for listening to me. A big overview in a short space of time.
Thank you, Amanda. That was fascinating. I particularly like the person-centered piece, which is so obvious when you say it, isn't it? And also what's interfering with being your best self. We could all frame everything in that, then that would probably go quite a long way to start with, I think. Yeah. Great. Okay, let's keep moving. So on to our next section. I'm going to welcome Louise Harvey, our Director of Propositions, to join us as well. I've got some lovely questions lined up to grill you all with. But in all seriousness, I'm really excited to hear a bit more about this. So firstly, Lou, coming to you, your team has done lots of research in this area. Can you share some of the insights and challenges neurodivergent individuals may face in regards to care pathways?
Yeah, of course. Firstly, I just wanted to say how amazing it is to be here and have such great engagement on this topic. And Amanda, that was such a brilliant opening, so thank you. I love the Galway comment as well. It was just brilliant and really practical. So thank you for that.
You're welcome.
So my team have been working on development in this area for some time now. And as Amanda has explained, there are lots of different areas where we need to consider support. One of the biggest challenges we've been facing into is the challenge of getting an assessment and diagnosis in order to access care pathways. So some insight, NHS waiting lists are at an all-time high. More and more people are therefore seeking a private diagnosis. Some recent numbers, about 32,000 referrals in the system in England and Wales for a diagnosis of suspected autism. And that's for both adults and children. About a third of adults waiting for an NHS ADHD assessment for 13 months or more. And we're even seeing waiting lists of up to 7 years in some of the parts of the UK. So some really good indicators that the system isn't coping with the level of demand. So then if you're looking at using a private provider, there are many private providers out there, but they've all got varying degrees of competence and expertise and experience. And it's really difficult to navigate and decide which providers are right. There's no single source of information for recommendation for a private provider, and making the right choice can be really confusing and really, really stressful for families. Private diagnosis hasn't always been accepted, and although we're seeing a U-turn on this, and this is a problem if treatment on the NHS is required or if you need other support. So for example, getting access to a school support for a child. And if a private diagnosis isn't accepted and the NHS diagnosis is the only way to access onward care and support, then you're caught in this cycle. So this is changing, given that waiting lists and waiting times have accelerated through COVID. The guidance now is that as long as the private providers follow the NICE guidance for assessments, they should be accepted by the NHS, by schools and by local authorities.
Thanks, Lou. I hadn't thought of the lack of provision, actually. That's a really interesting point. Amanda, coming to you next then. So I'm leading on from what Lou has said. This can be a hugely complex area. In your experience, what are the key stages and touch points of support an employer should consider to support a neurodivergent individual?
So I think a graduated response, really. Not everybody needs a diagnosis, but some people do. And the workplace role is really to make adjustments. So a knowledge in the workplace about how to support different people, being person-led, is going to be really important. But for some people, gaining a diagnosis of ADHD, for example, can lead to, for some people, really having medication, making big difference to their lives. Some people understanding about whether they are actually autistic or not can make a difference. So there is a pathway, there is a pathway through that for some people, a diagnosis can be really important. You need to, I think, make sure that you are going to the right people, because I think this is really important. There has been sort of pop-up of organisations that have suddenly popped up, which concerns me. And like we're seeing I saw somewhere the other day, a 10-year waiting list for autism and ADHD. That's not a waiting list, that's not a service. So for some people, really understanding their needs, but a graduated response, universal design, supporting individuals person-led, and if they need more, then into that clinical pathway.
Yeah, wow, 10 years, that is, you're right, that isn't a waiting list, that's crazy. So Lou, what are Bupa's plans to support neurodivergent conditions in and outside the workplace?
Sure, so I'll start with individuals. So as Amanda explained, it's one brain. So there's a connection between neurodiversity and mental health. And we've obviously got lots of support around mental health already for those that are suffering adverse mental health symptoms through all of our PMI products. So the services that we offer are access to our mental health specialist support nurses, our direct access mental health service, anytime health line, etc. And then separately, we're due to launch our diagnostic and assessment pilot in Q1 next year. So offering assessments for the diagnosis of autism and ADHD, carried out in a multidisciplinary team setting, following obviously NICE guidance and providing access to all of the appropriate onward care pathways.
Great, thanks, Lou. That gets me thinking actually about the links between neurodiversity and mental health. So Amanda, you're probably best placed on this one. Can you talk to us a little bit more about those links? And do you think employers should treat them separately or the same thing, or what's your view on that?
I think really important. I mean, I do say there's one brain, and we've seen sort of mental health first aider training going on. And I think this understanding about neurodiversity and mental health being bedfellows, and it's one brain, is really important. So I think it's important for employers to really encapsulate that. Again, you're being person-centered, you're understanding the individual. If you're worrying about work, you might not sleep at night, you might be more anxious. That has an impact on you in the daytime too. If you've got worries at home, that can affect you at work. So we can't separate these things. And actually having services that understand that understand the clinical aspect of neurodiversity and mental health under one umbrella, having those services and multidisciplinary teams, incredibly important. So we're not thinking about people in silos and sort of looking at anxiety over here and then looking at ADHD over there. So really important that we do think about one brain, one person, and really being person-centered.
Great thing. I'm pleased you said that, because it did sound like it should all be the same thing to me. So I'm learning something. It's good. So Lou, coming back to you then. So what support is Bupa providing employers to help them create more inclusive workplace in terms of neurodiverse colleagues?
Sure. So I talked about what we're doing for individuals. So talking about what we're doing for employers now. So educating and engaging employees is a key part of this. Ensuring that we provide the tools that are really, really practical. So a couple of examples. As part of our academy, we've a line manager's guide, but we've also got a new bite-sized module which is launching today that provides both tools and really practical support. And I've been watching it just before this morning, and it's led by Naomi Humber, which is one of our amazing clinicians here at Bupa. It's so practical. I really do urge you all to take a look at that. We also think that the assessment that I was talking about, the diagnostic and assessment pilot that I was talking about earlier, will provide us with insights, really deep insights that we can share with employers to continue, to help develop our proposition going forward. And we also work, a lot of the time with companies of all sizes. I think that's really key, right? This is not just about really big companies. It's about companies of all sizes on really specific and bespoke engagement support. So where they might have a particular problem, we can go in there and work with them to work on a particular engagement problem or education problem that they might want to have for managers or for their leadership team or for whatever.
Yeah, great. Thanks, Dan. I'm really passionate. This is supporting all businesses. You're quite right, not just ones of certain size. So, okay. So, Amanda, coming back to you, support is moving beyond just the employee. Have you seen any good examples of employers supporting parents and guardians with children of a neurodiverse condition?
Yeah, that's actually over the last 6-9 months, I'm seeing increasingly a number of organisations. I've gone in and done parent support sessions with the organisations to recognise that there are some people who may be neurodivergent, who may have neurodivergent children as well, a bit like me, right? Who might be sort of in the sandwich of trying to manage your own job, but also navigate the education space, which can be really challenging. Organisations and charities like the ADHD Foundation do amazing work going out and supporting parents as well, and other organisations. So there are some really good, I think, growing numbers of bigger organisations starting to do that, including insurance companies like Admiral and Auto Trader, I know, are coming on afterwards, doing some really good work. But there's lots of good companies around that are recognising the need to support their parents as well. So that's great news to see that happening.
Great, thank you very much. So, Lou, a couple of examples there with Admiral, for example. But what businesses are we seeing that are leading the way with neurodiversity support?
Yeah, so it's no surprise that the US has been leading the way in this area. They've got some really progressive employee support programs, and they've been in place for a number of years, as early as 2013. So a really good example, companies such as EY, Microsoft and SAP have been actively collaborating together to create specific programs of support for employees. So they collaborate on sharing of talent, for example, where someone might work in one organisation but be a better fit for one of the other organisation's cultures, and they work together to allow this transition across so that neurodiverse talent doesn't end up leaving. So a really great example of some really progressive thinking of companies working together. I think we can also learn a lot from the tech and banking industries, but they're not the only industries who are striving to support their employees. It's becoming the top of agenda for all companies, and we need to keep learning and working out how we can create innovative ways, like the example above, where talent is recognised and stays. And I think it's becoming, as we've just mentioned, it's becoming the norm with the companies that we work with, of all sizes wanting to do this. So, some really good, things that we see across the board: training of employees and managers about neurodiversity and what to expect from neurodiverse colleagues, set up and maintaining a strong system of support for those employees, and really, really considered methods for managing the careers of neurodiverse employees. And then, I won't talk about what people are doing for families, because I'm hoping Mark might come on to talk about that from an Auto Trader perspective. But yeah, we were seeing some great examples of how this goes throughout a holistic approach of supporting a family around this as well.
Great, thank you. Thank you, Amanda and Lou. Some fascinating points that I think we can all learn from. Particularly some of the content is worth looking at. I always think on all topics around diversity and inclusion, the biggest step to getting started is some of those practical things that you can do and almost see and touch to get into the subject and work your way into it. Right, before we get on to our next section, we have a poll for you. So the poll is: do you feel your business proactively supports neurodivergent employees? Now, we'll come back to this later, but we love a poll, so please get your answers in. Right, let's keep moving. So we'll now discuss the practical steps employers can take to support neurodiversity in the workplace. For this part of the session, I'm delighted to be joined by Mark and Richie. Mark is Customer Experience Director at Auto Trader, overseeing product, technology and design teams. Mark is the Senior Sponsor for Neurodiversity and Disability Network, and is also neurodivergent himself. Richie is Employer Engagement Manager at the National Autistic Society, leading their Autism at Work program. Richie has worked in the industry for over a decade and has several years worth of experience in supporting and coaching autistic adults into and in employment across the UK, as well as providing consultancy and training to FTSE 100 companies. She's also chair of the board for accessibility at the O2 Championing Neurodiversity. So welcome, Mark and Richie. It's great to have you here today. Mark, the first question is for you. Now, we've heard today it's important that all levels of the organisation have a role to play in supporting neurodiversity. Can you share with us how Auto Trader create a culture to support neurodivergent individuals?
Yes, so I'm building a great inclusive culture. It's been really important to Auto Trader. It's really important to us. As an organisation, we're very values driven. We don't just talk the values, we hire by them and we fire by them. And one of the values is community minded. And one way the community is manifest is internally is through our employee networks. And our employee networks are supported by our executive, our operational leadership team, the OLT, which I'm privileged to be a member of. Within those networks, one of them that was created, and it was bottom up, is the Disability and Neurodiversity Network. And it was formed to share our people's own lived experiences. So it's now more than just sharing or supporting making reasonable adjustments. It's about being more open and welcoming. So we've got 2 members of the OLT sponsoring the network, of which I'm one of them. I'm very open about my ADHD and sharing my personal experiences. And we want all of our colleagues to have awareness, insight and encouragement through learning from apprentices all the way through to senior leaders, that as a business we can celebrate the brilliance of differences as well as appreciating and supporting challenges that neurodifferences can bring. And then there are a bunch of practical changes that we've made. So providing training about the autism spectrum to line managers, colleagues, small things. In the organisation, we've recently refit our offices. So we're going to provide quiet individual workspaces with adjustable lighting for colleagues to use. It's really important. We encourage people to eat hot food and actually cold food in the canteen, not at their desk. As a neurodiverse person, smelly food can really trigger. At our events, our all-employee conference, Christmas party, we ensure that there are rooms, quiet rooms for people to go to. It's clear signage around our offices. There are a lot of small, practical things that don't cost anything that you can do to make people be aware and do make a difference.
Great, thank you, Mark. Some really practical stuff. I love the brilliance of difference as well. That's awesome. Okay, so Richie, coming across to you. So in your experience, what is the best way to engage managers and colleagues on how they can support neurodivergent employees?
Sure, and thank you so much for having us today. So my role is to engage managers and colleagues around this subject. And I think what we see is that education is really key. So people understanding neurodiversity and actually starting those internal discussions. And I think the most powerful way is actually hearing from neurodivergent people themselves, so that we can give feedback, so that we can understand exactly what's happening. I think we can often make assumptions that we might be making those positive changes. So even things like having staff surveys that might be able to go out to different people and say, actually, how accessible is this for you? Because I mean, even within the National Autistic Society, we have to do that. And recently we had a change to our holiday days where it's sort of unlimited holiday, and you might think, oh well, that's fantastic, there's that really supports everybody, but actually not putting sort of boundaries around that for a lot of our autistic colleagues, that was really challenging. And so we had that feedback, and then we could implement the change. I think it's often that we can kind of make those assumptions. I think it's really important to dispel myths, again, through education, through having things like webinars and lunch and learns, events like this, where you hear from neurodivergent people themselves as well. So I think that's really powerful, and looking at the design as well, and that all sorts of different people are involved in that as well.
Great, thank you. I particularly like the myth busting. If we're going to get people to really engage with this, then myth busting is so important, isn't it? Okay, so Mark, coming back to you, you're open that you've been diagnosed with ADHD. So as a business leader, what was your experience like when sharing this with your team?
It was very easy, but I think it was because of our culture and being open and transparent. And actually, it's because I'm a little bit different, so it wasn't a surprise, I suppose. I'd watched, or my wife had watched the night before, Rory Bremner talking openly about his ADHD, and she said, I think you need to watch that. I think you might have that. So I did what you do. I went to Dr. Google, and Dr. Google suggested maybe you might have ADHD. And I went into my work the following day and said to the team, you know what, I might have ADHD. And they were like, yeah, no shit, Sherlock. I had the diagnosis, and Amanda was talking earlier on about how difficult and how time-consuming how long it can take to get one. I think the real big difference that it's made is that previously, Mark's a little bit different. So, he'll say things, he'll jump up and down. At our offices, all of our walls you can write on them, you can draw on them. Because I'm a visual thinker. But so often it's Mark being Mark. Now with the diagnosis, it's not just Mark being Mark. It's Mark, and he has ADHD, and that ADHD, that's his strength. That is his superpower. So I'm able to think differently and just throw chaos bombs into work often, but it's seen as a good thing.
Yeah, that's amazing, and the superpower, I'm loving that. That's really good way to think about it. And okay, so coming back to you, Richie, every business is on a journey to create a more inclusive workplace for everyone. Can you share some examples of practical steps employers have taken to support neurodivergent conditions that have also benefited the rest of the workforce?
Sure. So again, I think it sort of comes back to that open dialogue where we can sort of challenge culture, some of the unwritten rules of the workplace, and the workplace is full of them, and we often don't even realise. And also we don't necessarily realise how much of a barrier they can be to people. So even things that seem relatively small, like the tea and coffee rule, for example. I remember working with a fantastic autistic CBT therapist who shared with me that she'd not had a cup of tea at work for 10 years because because she had to move around different areas of the country. She would have to learn a different rule for each clinic that she worked in, and she said she just couldn't bear it because there would be an unwritten rule about you can't use a specific mug, or there was do you offer it to the person next to you or a whole bank of desks? Do you accept from the CEO? And she said it was just too difficult for her to navigate. And we have all of these rules. And I think sometimes when you open that dialogue with other colleagues, they might say, actually, it would be really helpful for us all to talk about some of our unwritten rules and sort of kind of decode them together, because actually this can be something that we all sort of kind of struggle to navigate. So with the program that we run, the Autism at Work program, we work with employers to look at their internal processes. We look at creating things like interview packs so people know what to expect, pictures of who might be interviewing them, as well as things like maps and just helpful things to know. And then we do that with the candidate pack as well. So when somebody starts, it's a welcome pack, and part of that will be things like the unwritten rules, expectations, this is where you can buy your lunch, and these are good things to know, dress code, because that might even vary within an organisation. So at the National Autistic Society, we might dress differently in the employment team compared to the cool kids who work in marketing, and they might have ripped jeans. So it's just helping people to really understand and break those things down, and just bringing best practice in as well. I think we're so busy these days, we forget about things like agendas and timelines, and we forget about all of those small things. Actually putting those back into practice, I think, really benefits everybody.
Yeah, communication is so important, isn't it? And recognising what's going on for people. Going back to Amanda's person-centred, communication rather than something for the masses. Great. Okay. So, Mark, have you ever noticed someone at work struggle with a neurodivergent condition, and what would you say is the best way to address this?
So I think that I'll answer in a couple of ways. Not so long ago, I gave a presentation to the organisation about neurodiversity and about my personal experience. And at the back of that, quite a few people contacted me and reached out. I was going to point them in the direction of our people operations team, because I recognise what you're talking about. And also line managers came and talked to me and said, we think we've got this individual, and how should I work through that? And I think that's really important when you talk to people. My position, I think, is about making the conversation open and sharing that neurodiversity, neurodifferences are something to be celebrated. But practically, it's very much talk to your line manager and helping support line managers to understand individuals and to open up the conversation. I think as soon as we're aware, we can be very, very good, but it's about creating communication and let people share their stories. So if you do recognise that there's somebody might be having challenges, we're in an organisation where we create that culture where people can be open and talk about it. There's no stigma attached to it.
Great, thank you very much. That's great. Okay, so just to finish off this section, Amanda, Richie, I've got a last one for you. So Amanda mentioned the value of recruiting neurodivergent talent, but also the importance of support across the whole employee journey. So on the work you do for the Autism at Work program, what are some of the biggest challenges employers experience when implementing the programs?
Sure. So I think the biggest thing, and I think Amanda highlighted this beautifully, is we have to research ourselves from the YouGov polls have said that actually fear and worry around getting this wrong is a really big thing for employers, and that's again why education and that discussion piece is so important. And we also know that 64% of employers have said that they don't know where to go for support, but there's lots of different organisations who can support you. I think it's about getting, starting that discussion and not feeling too scared about it. Yesterday, I went to an event where an autistic woman said that actually the most supportive thing she's found is when people have come up to her at work and said, actually, I don't know anything about your condition. Can you educate me? Can you tell me, how can I even talk about this? Because there's a lot around language, and that can be a barrier for some people because they're scared that they might say the wrong thing. And also, as Amanda said, it has to be person-centered. It's just so, it's really individualized. So there's that. And I think we have to think about the whole process. And sometimes the difficulty with implementing that can be things like bureaucratic processes that people are not willing to change. It could be getting buy-in from the different people at each of those stages as well. So again, it's just helping people understand that actually this isn't rocket science. It's not that difficult to change some of these processes. They can be really simple adjustments that actually really help everybody. For example, we work with employers to look at the recruitment process. So we're looking at even the job description. Very often a job description doesn't really describe what the job is, and then it could be something like questions in advance. Wouldn't that be wonderful for everybody? Because it's not a memory test. It's just, these are the things that we want to talk to you about so that we can understand you and see whether you're a good fit.
Great, thank you very much. Thank you both, Richie and Mark. I mean, it strikes me that being open, being curious, communicating, and taking a person-centered approach would go a long way to get started and help people kind of destigmatize, demystify the subject. So thank you very much. Right, we're going to keep coming on. We've got loads of questions, so we're going to come on to those in a second. I just thought this was an interesting fact that we found. It said that 25% of CEOs are dyslexic, but many don't want to talk about it. So it strikes me that if more leaders were to self-identify as neurodivergent, perhaps the rest of the workforce would feel more comfortable to do so. It's an interesting fact to think. Now, okay, you know that we love a poll, so I've got another one for you. I will tell you the answers or the outcome of the last one at the end, but here we go with the next poll. So does your organisation provide line managers with resources to support neurodivergent individuals? Okay, so we've got time for some questions. I'm going to bring the full panel back. Now, we have had loads of questions, so thank you very much. Keep them coming. If there's anything that we don't get to today, we will answer them offline and we'll follow up separately. So without further ado, given we've got so many, I'm going to get us started. So I'm working between different devices, so apologies if I'm looking down at times. Where shall we start? Richie, I'm going to come to you first, given you're already in the chair, so you're used to talking. So how can employers practically adapt their recruitment processes?
Sure. So from the beginning, it's just looking at things like the job description. Does it really describe the job? And we tend to see a lot of these core tick box things. So like team, must be a great team player, or there might be a focus on communication. But what does that actually mean? So I think breaking that down, does being a great team player mean that you'll be leading a team? Does it mean that you just need to get on with your colleagues, which is kind of a given? The same with communication. What are the expectations around that? And I remember working with a museum who were digitizing a collection of species. And one of the things that there was a lot of focus around teamwork and around communication. But when I actually went to visit, it was, I mean, I was expecting this to be a really buzzy, dynamic place. And when I went in, it was silent. Everybody was working on their own. It was fantastic. And they were taking photographs of moths. And so actually what you needed was a great attention to detail. You needed to be handling everything with respect. So that would have been more helpful to put in. And then also thinking about the interview process, questions in advance, thinking about the environment, and just making sure that people know what to expect so you can get the best out of them.
Great, fantastic. Thank you very much. Okay, so let's keep us moving. So I'm going to come to Amanda next. So emerging research suggests neurodiversity can develop later in life due to trauma. Is there a consensus on this, and how hard is it to get a diagnosis later in life?
Well, first of all, we're seeing that conditions like ADHD, which we thought were purely developmental, we're seeing that some people emerge later in life getting symptoms and signs. This is where a good clinical team are really important, because we've got to rule out as well as rule in the diagnosis. So somebody with, say, traumatic brain injury can present with ADHD symptoms, but it could be due to the head injury. So we're getting an understanding that presentation of symptoms and signs can change over a lifetime. That's really important. So recognizing that is going to be essential. So we're also recognizing that I remember 35 years ago when my son was diagnosed with dyspraxia, I was told he was going to grow out of it. Whatever it was, he was going to get a birthday card on his 16th birthday, and that was it then. We recognize that people are emerging either being missed because, and we see females particularly with ADHD and with autism, who have often masked or not been identified because till relatively recently, we were looking through that lens. It was a very male lens. We're looking at ADHD, we're looking at fidgety, busy boys, and we weren't looking at dreamy, doodly girls. And I was one of those. So my presentation was only recognized later in life because in school I was whispering to the girl next to them. I was doodling, I was helpful. And actually that's what you see with girls often mask much more and are much more overtly helping, masking, modeling what's going on and getting missed. So this is an emerging area, even though it seems like we've been working on this a long time and there's lots of research, but understanding adults and adult needs and the support needs we need is going to be really important. And that goes back to the question you asked earlier about parents. So that what parents need to support themselves in the workplace to do their job and to support their children is also important as well, because that has an impact on your mental well-being, your productivity. And often we see some people not going for promotion because they can't manage it. They can't manage job, children, navigating a system and coping with change as well. So it goes back all the way around to being person-centered and recognizing different pressures on you at different stages in your life may mean different things will present themselves. So you might, it's a bit like that whack-a-mole. One thing goes and another thing pops up.
Great, thank you very much. Super interesting. I'm interested, Mark, do you think your career would have been different if you'd had your diagnosis earlier?
I think yes and no. So I was lucky I started my life as a consultant. So I was an IT consultant and very quickly I joined a great team and I would go into clients and I'd jump up and down and draw pictures and actually that hyper focus for a short period of time really helped me. It was great. My team recognized me. However, if I do remember the very, very first project I worked on, which was a very short period of time, I absolutely hated it. I come home in the evening crying. I was in tears. I absolutely hated the project. And I was being asked to do really menial work. For me, it was like PowerPoint and I was constrained. And the team I was with just didn't understand it. And they thought I was useless, rubbish. And I suspect that if I'd had the diagnosis, I would be able to say, look, it's yes, it is me, but ADHD and I'm doing the wrong thing. You're not seeing the full potential. And it probably would have helped me move to a different team. And certainly where we are at Auto Trader, we want people to focus on your strengths. There's nothing worse than being told, this is your development area. If I'm not very good at something, I'm not very good. I'm good at this stuff. Help me really develop. Find my strengths. Find your strengths and really promote them.
Great, thank you very much, Mark. Super interesting. So Lou, given all this and everything that we've heard, I know we're looking at a pilot. So what are we focusing on there, and how are we looking to help employers?
So the pilot that we're focused on for Q1 next year is at the moment focused on autism and ADHD. And we're focusing on those two areas because it's not because we think that's it, because we know that there's a lot to do here, but that's the greatest need in terms of NHS wait times and constraints on resource. So that's where we're starting, but we see this as an ongoing iterative proposition. So that will focus on, as I said earlier, that if someone presents or wants to go through that process, then the client has that benefit. They can request this assessment, they can go through it, and that's adults and children following a referral from their GP. And if anybody wants some more information on that, obviously, anyone on the call, speak to your account manager.
Cool, thank you very much. Now, Mark, we've got a question in the chat for you here. So it goes, I can really relate to the chaos bombs How do you get people to see this as a positive in your senior leadership role?
So I think we've got a great leadership team, and they understand me. And so I've been in the business for 9 years. So sometimes what they'll say is they actually don't know what to do with it. You know, it's like, here's a gift, boom. So what do we do with that piece of information? And sometimes that makes me feel quite, well, nobody's listening to me. And feedback is you repeat yourself too often sometimes. But actually it makes a difference. It does get people to think slightly differently. One of the challenges of being a leader, I find it quite hard sometimes, is that I'm put on a pedestal, and my words that I say often, it comes with certain responsibilities, and that can sometimes be a challenge for me. But I'm not sure I've answered the question. But.
No, that's all good. Thank you very much. I've got another one now coming from Amanda, but I think, Richard, you might have a view on this as well. So, Amanda, you had a slide that showed that 54% of improvements would be attitudes by others. And I think the reflection of this person is attitude is free, but is also the hardest thing to change. So have you got any advice for us all?
Yeah, I do. I think one of the things is don't ask, but when you ask somebody to do something, don't assume that they've understood it. And if you start off with that premise that communication is a dialogue, not a monologue, that goes a long way. And that means that it isn't the onus of and the responsibility in the other person not to get you. It is about getting each other. Then that starts a conversation together, which is, how do I communicate best with you so you understand what I'm doing? Maybe I've sent you a long email with 27 things to do, and the most important thing is at the bottom of the email. And you started at the top. This was an example of somebody the other day who started at the top diligently, but didn't do the important stuff at the bottom. Well, a dialogue says, I will now indicate in colour the things that you need to do first, and a date and time stamp. So I think attitude is about having, it's about people feeling safe to have the conversations, like we're hearing from Auto Trader, that you feel safe to have that. You're not going to be fearful about it. It's about respecting the fact that we'll get it wrong loads of the time. And if we start off with that premise that we will miscommunicate, we do that all the time. We say something, we think it's been understood. And if we do that all together, then I think we can go a long way to make a difference. So I think it is about dialogue and looking at the difference between live communication and asynchronous communication. And we might need to think about rules for both of those.
Great, thank you very much. Richard, have you got any builds on that? Oh, you're on mute, I think.
Oh, I thought I got through that. Never mind, nearly. No, completely agree with what Amanda said. And I think I would add that I think people understanding and being able to empathise. So again, having that education piece. And when you realise things like the impact of the sensory environment or interactions with other people, you can then have a think about those things in different scenarios and contextualise them. So for example, if you do have somebody who really struggles with sound, but you and a colleague are talking between them, how is that going to impact that person? So you can just change the culture and make sure that you book a meeting room. Or things like Christmas parties, does everyone have to go? And one of our colleagues, I remember, the difficulty wasn't that she didn't want to go to Christmas parties, it was the transition of walking into a Christmas party. So, you know, you arrange something where you can walk in together. And I do think it's just tiny things make a huge difference to people.
Great, thank you very much. And thank you to the whole panel. That probably brings to the end that section, but thank you very much. And we're coming towards the end of today. I know you'll all be extremely excited to hear what happened in the polls. So let me tell you very quickly. The first question was, do you feel your business proactively supports neurodivergent employees? And we got a 19% for yes. So it feels like there's quite a lot of opportunity for us all to make a difference back in our businesses. And 50% somewhat, and 30 on no. And then the second one was, does your organisation provide line managers with resources to support neurodivergent individuals? 76% no. So it feels like this is a very live conversation, an area we could all make lots of difference. So thank you very much for joining us today. We've had a great session. I've really enjoyed the discussion. I think loads of takeaways, but being person-centered, being curious and open and communicating and having the discussion are the things that really stick with me. As Lou mentioned, we're launching a new bite-sized academy module to support line managers to open up the conversation on neurodiversity. So look out for this on email. I hope it's really helpful, and let us know if there's anything else that we can do to support you as well. Thanks very much for joining.